Hi guys, it's me, I'm Dr. Lafi Shammari, and today we will talk about autoimmune liver disease. Actually guys, autoimmune liver disease, we have three important diseases. First one called primary sclerosing cholangitis, this is number one. Number two, we have primary biliary cirrhosis and then autoimmune hepatitis. So we will discuss all these three diseases. First of all, let me start with primary sclerosing cholangitis. What is it? This is the biliary system. Biliary system actually form of left hepatic duct, and then we have right hepatic duct. They join together and form something called common hepatic duct. The common hepatic duct will communicate with the cystic duct that come from the gallbladder and form to us common bile duct. Then common bile duct will communicate with pancreatic duct, and they will open in the ampulla of Vata in the second part of the duodenum. Now, primary sclerosing cholangitis, actually it is diffuse inflammation of the biliary tree. So here the whole biliary tree that we have, it is full of what? Full of the inflammation. So this inflammation process will lead to stenosis and obliteration of the intra and extra bile duct. This obliteration or this stenosis will lead to three bad things. First of all, maybe they will have hepatic failure, or maybe we will have hepatic cirrhosis. And third thing is we will have portal hypertension. Okay, now there is something important about primary sclerosing cholangitis, and this thing every doctor afraid of it because it have a percentage about from 10 to 30% it will form to a cancer called cholangiocarcinoma, and it is actually affect the men. If the young men, actually the age is gonna be from the 25 to 40 years. And most of these men will have something called ulcerative colitis. So now we have to know that the primary sclerosing cholangitis is associated with ulcerative colitis disease. The second thing we will talk about is how to diagnose and how your patient will come. Actually, the diagnosis is depend on a criteria. I will say draw it as a triangle because the criteria it's a 3. So first criteria is said that it is actually generalized stenosis on cholangiography. So when we do it by ERCV or even MRCV, you will see a stenosis in the bile tree. So this is first one is a generalized stenosis. Number 2, absence of cholelithiasis, which is stones. So there is no stones. And third thing is exclusion of any bile duct cancer, CA. By what? By following up. So now we have 3 things to diagnose patient with primary sclerosing cholangitis. First one is the patient will come with generalized stenosis by cholangiography. Second thing, we have to exclude there is no cholelithiasis, and third thing is we have to know that there is no cancer, exclusion to the cancer. So the patient, he will be ulcerative colitis patient, and we will see his alkaline phosphatase is high. Also patient will complaining of fatigue. He's tired the whole time. Third thing, there is a pruritus. Pruritus because there is a persistent jaundice, so this will lead to itching, and by examination you're gonna find a scratching mark on the patient's body. There's also, we have upper quadrant discomfort, or even pain. So when you come to exam patient, you're gonna find hepatosplenomegaly and you're gonna find jaundice. How to investigate this patient? Divided to biochemical, and we have radiological. Actually, the radiological is the key of diagnosis. And which type of radiological? We will do it by MRCP, and it is the diagnostic for the patient who have primary sclerosing cholangitis. The biochemical, you're gonna see alkaline phosphatase is high, as we mentioned before. One. Number two, you're gonna liver function test, also high. Positive ANA, which is called anti-nuclear antibody. Of positive asthma. Asthma is actually anti-smooth anti-muscle antibody, ASMA. So this is gonna be positive. This is actually not diagnostic. Why? Because it is not specific for this disease itself. How to manage this patient? Unfortunately, the patient with primary sclerosing cholangitis, he is not cured forever, so there is no cure treatment for it. Only try to cure complication and treat the symptoms. So first of all, we have to treat patient by something called UDCA. The UDCA, guys, it's actually called urodeoxycholic acid. Urodeoxycholic acid, it's important drug in these cases. It will help you to improve bile flow and replace toxic hydrophobic bile acid. It's reduce apoptosis of biliary epithelium, improve the liver function test, and slow down histological and clinical progression. Now, second thing you will do it for this patient is to treat pruritus. Actually, guys, pruritus is a very irritative symptom. It is so annoyed for the patient. So treat it by something called cholestyramine. Actually, how cholestyramine will work? Cholestyramine, so this is, guys, this is the, let me say, this is the intestine. So cholestyramine, actually, it is a resin binding and to potential pruritogen. So let me say this is the pruritogen, and this is the cholestyramine well attached to it. I'm gonna just throw it like a heart because it is the very favored drug, and at the end of the story it will lead to excrete this pruritogen by stool. So third thing is treat by antibiotic actually with cephalosporin if the patient has acute cholangitis attack. If cholangiography showed extrahepatic duct obstruction with no evidence of cholangiocarcinoma, so try to do ballooning dilatation or even stenting by ERCP. So try to give patient a fat-soluble vitamin, and number 6, if there was an osteoporosis treatment. Osteoporosis, just give treatment. Actually, in the patient in this case with the liver disease, he will have something called hepatic osteodystrophy. What we mean by hepatic osteodystrophy? Actually, this is the liver. Okay, the liver, we said the vitamin D is cantilever and it is inactive, but it will activate by a hydroxylation, specific hydroxylation process, and it will become active vitamin D. So this activation will help vitamin D to work. How vitamin D work, or even what actually its function? It will attach to the calcium and help in the absorption of the calcium. Who's the one who gonna use the calcium? The bones. The bones will use the calcium to build its structure. In this case, patient don't have vitamin D. So calcium is actually not useful because the absorption can't be done unless vitamin D is found. So osteoporosis or even osteoarthritis gonna happen. Last thing we will do in this patient, transplantation. Liver, number 7. We have liver transplantation. But don't forget that in the transplantation you have to exclude that patient don't have cholangiocarcinoma. So transplantation. This is the liver transplantation. So this is all about primary sclerosing cholangitis, and then we will talk about primary biliary cirrhosis.